Hello everyone, welcome to my channel Physiotherapy Online Lectures. Today we are going to study the lower limb anatomy. Lower limb joint is hip joint. The hip joint, firstly we will study the type and variety of hip joint. The type and variety is the synovial type and ball and socket. Same as the same as the shoulder joint of the upper limb. Okay. Next, the articulating bone or the head of the femur, which representing the ball, and socket joint, which the femur head of the femur representing the ball, and articulates with the acetabulum of the hip bone, which represent the socket. Okay. Here we'll see. This is the head of the femur, which articulates with the acetabular socket. This represents the ball and this represents the socket. That's why it is known as the ball and socket joint. Okay. Now head of the femur, it is spherical in shape and forming about 3/5 of a sphere, which is directed upwards. Most important part, the head is directed upwards, backwards and medially. Upwards, backwards and medially. It is smooth, covered by articular hyaline cartilage except the central depression called the fovea. Okay, except the central depression called the fovea. Yeah, here there is a central depression that is called the fovea. All are covered with the hyaline cartilage except this portion. This is one of the important questions which comes in the practical purpose. So note it out. Next one is the acetabular. It is a deep cup-shaped concavity in the lateral aspect of the hip bone, which is directed downwards, forwards and laterally. The acetabulum is directed downwards, forwards and laterally. It has C-shaped smooth articular surface called the lunate surface, which is covered by also the hyaline cartilage, and its margin is deficient, forming the acetabular notch, which is bridged over the transverse acetabular limb. This is the margin is deficient below the acetabular notch. There is acetabular notch. Yeah. See, this is the acetabular notch. Okay. Yeah. This portion is the acetabular notch. You will see in the practical, when you will see practical of the hip bone, you will see it. Next, fibrous capsule. It is a strong fibrous slit connecting the articulating bone. Attachment are the proximally it is attached to the acetabulum 1-2 cm outside the labrum or acetabular labrum, which is commonly known as the acetabular labrum. Distally, it is attached anteriorly to the intertrochanteric line. The fibrous capsule, intertrochanteric line, and posteriorly to the neck of the femur, half inch above the intertrochanteric crest. So here, intertrochanteric line and intertrochanteric crest. This is the intertrochanteric line. Okay. Next, we'll study ligaments of hip joints. Ligaments, 3 ligaments strengthen the capsule externally. The iliofemoral ligament, okay, which is the strongest ligament of the body. It is inverted Y shaped. And next one is the Pubofemoral ligament, it is triangular shaped. Okay, and next one is the ischiofemoral ligament. Three main ligaments of the hand. Last, also another ligaments are there, except these three are the acetabular labrum. I already told, it is a ring of fibrocartilage fixed to the rim, and next one is the transverse acetabular ligament and ligament of the head. Okay, it is round ligament, also known as a round ligament or ligamentum teres. Next, we will go to the relations of the hip joint. Relations superiorly, it is head of the rectus femoris, gluteus minimus, and gluteus medius. Posteriorly, piriformis muscle are there, and both gemini are there, quadratus femoris, and sciatic nerve. Laterally, you can say gluteus medius, gluteus minimus, and tensor fasciolata muscle. All muscles are there, and inferiorly, obturator externus muscle and medial circumflex femoral artery, which is inferiorly. To the anteriorly, there are straight head of the rectus femoris, bursa of the psoas, iliopsoas, and pectineus muscle, and femoral vessels and nerves. So, it normally don't comes in the exam. This portion, the relations, okay, normally don't come in the exam, but you have to know if it's asked in the practical purposes. Okay, next one is the movements allowed. It's the flexion and extension occurs in the transverse axis, medial lateral rotation, vertical axis, abduction and adduction movement in the posterior axis, anteroposterior axis, and the circumduction with a combination of all the above movements. Okay, these are the movements which allowed in the hip joint. Okay, so there is a notable point is there. Here is the neck and shaft angle. This one, neck and shaft angle. What is this? The presence of the angle between the neck and shaft of the femur. This is the neck and shaft of the femur. Okay, this one, neck shaft angle. Okay, and next one is the muscles. It is important part. You have to write in the exam. You will be asked in the practical exam. This portion is the most important. What is the muscle producing the movement? The flexion. This chief muscle is iliopsoas, the psoas major and iliacus, and accessory muscles are the pectineus, rectus femoris, sartorius, and adductors, mainly the adductor longus. Next one is extension. Extension is performed the chief muscles of the gluteus maximus during standing from sitting position, running and climbing a step, and the hamstring on walking on a level surface. Okay, these are the extensor muscles. Abduction mainly by the gluteus medius and minimus. Okay, and accessory are the tensor fasciolata and sartorius. Adduction is performed by the adductor muscles, that is adductor longus, adductor brevis, and adductor magnus. And accessory muscles are the pectineus and gracilis muscle. The medial rotation is performed by the anterior fiber of the gluteus medius and minimus. Lateral rotation is performed all the 6 lateral rotators. Okay, and the gluteus maximus and sartorius. Okay. Next, we will go to the blood supply of the head. You have to write it down. The blood supply are the medial and lateral circumflex femoral artery, and a small part of the head is supplied by the arteries passing the ligament of head of the femur from the acetabular branch of the obturator and medial circumflex femoral artery. You have to write the name only. Okay. Next one is the nerve supply. nerve supply by the femoral nerve mainly through the nerve of the rectus femoris and anterior division of the obturator nerve, sciatic nerve, and nerve to quadratus femoris. Okay. Next, we'll move to the stability of the hip joint is through the but the very stable joint due to the following factor. One is bony factor, spherical head, which fits well to the deep acetabulum. Next one is the ligamental factor, with the capsule is very much strong, which reinforced by very much strong ligaments, the 6 ligaments, mainly the 3 ligaments, iliofemoral ligament, which main. And the muscular factor, the joint is surrounded all by the strong muscles. Okay. This you have to write in the theory purpose and also in the practical. Now the applied anatomy is the what neck femur fracture. Commonly, the old person due to osteoporosis, it is common in the intracapsular, and due to this neck femur fracture, here avascular necrosis of the head of the femur very much common occurs. Avascular necrosis, which is also known as AVN. Okay, commonly known as the AVN. Next one is the dislocation of the hip, which may be congenital, which is commonly known as the congenital dislocation of the hips. Especially, you will study it in the third year orthopedic, congenital dislocation of the hip. And another is the coxa vara and coxa valga. Just like decrease in the neck shaft angle causing the mild shortening of the lower limb, and increase in the neck shaft angle is due to the lengthening of the lower limb. Coxa vara, which is abnormal decrease in the neck shaft angle, and coxa valga is the abnormal increase in the neck shaft angle. It is the neck shaft angle. Yeah. Okay. So this is the hip joint anatomy for the theory and practical purpose. Okay. Thank you.